From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
On today's show, we're discussing generative AI tools that patients are using to answer questions about their health. I'm Jennifer Abbasi, Director of JAMA Medical News. Lead Senior Staff Writer Rita Rubin is here to talk about her story. Hi, Rita.
Hey, Jen.
So you looked into new artificial intelligence tools for patients that are in development or are already available, like the new ChatGPT Health. What did you learn?
Well, it looks like Dr. Google is being usurped by Dr. AI. ChatGPT is only 3 years old, but 800 million people use it each week, and 1 in 4 of them have health questions, according to OpenAI, which is the company that developed the chatbot. In January, OpenAI launched ChatGPT Health to meet the demand. OpenAI wouldn't tell me how many people are using this health-specific version of its chatbot, but it currently has a wait list as they incorporate feedback from the early adopters. ChatGPT Health is one of many patient-facing generative artificial intelligence applications in various stages of development. They can answer questions about post-operative care and make complex scientific information, such as clinical trial descriptions, more reader-friendly. And within the next couple of years, a new government-funded project aims to develop AI applications that will be able to make autonomous decisions about the care of patients with heart failure. Now, unlike ChatGPT Health, these other patient-facing AI applications train only on verified medical information, and recent research has raised questions about the accuracy of health advice from commonly used chatbots. Using vignettes authored by physicians, what's likely the first study to assess ChatGPT Health's performance found that the chatbot's triage recommendations were least accurate for the most and the least serious conditions. Nate Gross, who oversees health strategies for OpenAI, told me that the company worked with hundreds of physicians in developing ChatGPT Health, which, he said, is designed only to provide people with information, not tell them whether they're healthy or sick. The physicians I talked with said they advise patients to check with them first before acting on advice they get from a chatbot, especially if the stakes are high. Another concern about ChatGPT Health is privacy. The chatbot invites users to upload all their medical records, including data from their smartwatch, so it can provide personalized information. Now, OpenAI's Nate Gross said that the company has implemented more privacy protections with ChatGPT Health than with ChatGPT. But unlike physicians or hospitals, chatbots and their developers are not covered by HIPAA.
So, Rita, could chatbots' inaccurate answers about healthcare be due in part to user error?
Well, Jen, a study of 3 different chatbots, including ChatGPT, certainly suggests that's the case. It found that when people with no medical training were asked to convey physician-authored vignettes to a chatbot, they often didn't provide complete information. ChatGPT Health asks users to upload all their medical data, but that might be a challenge for patients who've received care and undergone testing or imaging at multiple health systems.
Okay, so tell us more about AI applications that could make decisions about patient care on their own.
I know it kind of seemed like science fiction, and really they don't exist yet. But ARPA-H, which is under the U.S. Department of Health and Human Services, just launched an initiative to encourage the development of patient-facing AI applications for people with heart failure, many of whom live in counties without a cardiologist. The tools would be clinician extenders, not clinician replacers, and would be made available only after rigorous testing and research demonstrating that they measurably improve safety, outcomes, and equity. Patients would be able to tell these AI applications about a change in their symptoms, and then the AI tool would be able to advise them on whether they should go to the emergency department and tweak their prescriptions if necessary. Although the first such tools will be for patients with heart failure, ARPA-H hopes eventually they'll be developed for a wide variety of conditions as well.
Thanks, Rita. If you'd like to learn more, we'll include a link to Rita's story in the show description. You can find that and all of our stories at JAMAmedicalnews.com. I'm Jennifer Abbasi. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at JAMAnetworkaudio.com. Thanks for listening and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.